Hi, my name's Rachel Thorpe. I'm a research fellow at Australian Red Cross Lifeblood. I'm a sociologist with expertise in gender and ageing and health. I mostly use qualitative research methods, and my current interests are in the social context of blood donation, what makes it possible to donate blood in a particular place and time, and how we can encourage people to engage with blood donation as a meaningful social practice. And also, I'm interested in how blood collection agencies can diversify what they do while maintaining donor and public trust. Today, I'm presenting two projects looking at the meaning and experience of donating blood in later life. So, why are we interested in older donors? Well, populations around the world are aging as people are living longer due to improved health services, safer working environments, and medical advances. As a result of population aging, blood services around the world have predicted that aging populations may lead to shortages in blood supplies as an increasing number of current donors become ineligible due to age-related health conditions and growing demand for blood products. But blood collection agencies have traditionally therefore focused on strategies to recruit younger donors who are expected to be required to replace older donors. However, older adults are also currently can expect to be healthier for longer than previous generations. And although blood collection agencies have focused on recruiting younger donors, older adults could also make a substantial contribution to blood supplies when they're eligible. Research shows that older adults tolerate donation well. So in the past, there have been concerns about the safety of donation for older adults. However, studies have concluded that age-based exclusions from donation based on safety concerns were not warranted. For example, a recent BEST collaborative study compared deferral and vasovagal rates for whole blood donation between donors aged 24 to 70 and 70 plus, and found that actually exclusions based solely on age were not warranted. Currently, the upper age limit for donation varies around the world, with some countries such as the United States, Canada, United Kingdom, not limiting donation for existing donors, while other countries around the world continue to impose age limits. In Australia, the upper age limit was removed for existing donors in 2019, while for first-time donors, it was raised from 71 to 75 in recognition of the fact that donation is safe for older adults. And while this evidence suggests that blood donation is safe for many older adults, it's also important to sort of consider whether people would want to donate blood and how social factors may contribute to this, to a desire among older adults to continue to donate blood. For example, as different generations of older adults age, they bring with them different expectations of old age. And I guess it's generally understood that meanings of old age are changing, particularly as the baby boomer generation, who are currently aged in their 50s to 70s age. These older people have, on average, higher levels of education, higher wealth, and are generally expected to have greater expectations of old age, and potentially to be questioning policies of deferral from blood donation based solely on age. What else do we actually know about older donors? There's some research that suggests that older donors differ from younger donors in their motivations. They have time and capacity to donate, and are likely to be positively oriented towards blood donation as a form of community engagement. Outside of ageing research, but looking at the volunteer literature, self-rated health has been shown to be associated with volunteering, and being healthy has been suggested to motivate blood and plasma donors of all ages to continue to donate, and is associated with donor identity. However, there's little research of the needs, motivations, and intentions of older blood donors. So in this talk, I'm going to discuss the findings of two studies that we've conducted here at Lifeblood. First of all, a qualitative study that explored donors' perspectives on donating blood in mid to later life. And secondly, a survey of older donors about their experiences of donating during a pandemic. So the first study, our aims were to explore the influence of age and length of donation career on donor motivations among donors aged 50 and over, and to explore donor perspectives on changes to the upper age limit, which were had just taken place at the time that these interviews were conducted. So donors were eligible to participate in this study if they were aged 50 and over, had donated whole blood and or plasma for at least 12 months prior to participation, and were not currently deferred from donation at the time. We conducted semi-structured interviews with 34 donors, which was a response rate of 27%. The focus of the interviews was on people talking to us about how they became blood donors, how they remained donors, experiences and meanings of donating in later life, and their perspectives on raising the upper age limit for donation. Interviews lasted for approximately 30 minutes. We coded our interviews by using a descriptive coding framework that captured key concepts from the research questions, the literature, and the interview transcripts. Two researchers met to agree on the framework and to ensure that the codes made sense to both researchers and were adequately defined. Higher level thematic codes were then created by the research team by grouping together codes that described current meanings of donations and intentions to continue to donate. And I'll discuss these themes in the following slides. So participants commonly spoke about donating blood in later life as a way to give back to their communities. And by this, they referred to in later life having resources and capacity to participate in volunteer work such as blood donation because of either having time or money or both. Obviously, money is not directly related to blood donation. However, having money was discussed as giving people time through being able to retire, and also to be able to engage with other sort of volunteer work, such as donating money. Participants also talked about giving back in the context of having enjoyed fortunate lives. So they talked about having had good employment throughout their lives, being able to accumulate wealth, and believing that our society would be a better place if everybody who had had a good life gave something back to the community. The participants who talked about having more time talked about either being able to start to donate blood or to donate more frequently because of having a little bit more time to themselves, such as having children who were grown up and had moved out of home, or having retired or semi-retired. Participants also commonly perceived that they had more awareness of the ongoing need for blood and blood products at this time of their lives and donor careers. For some, the benefits of blood products had become more relevant to them through knowing recipients, while others felt that they now had more appreciation of the importance of donated blood to patients and the health system, as well as of the small number of people who actually donate, and therefore of, the importance of donors. In the interviews, participants also demonstrated having acquired knowledge about blood donation through being donors. So, for example, they talked about what they knew about how donated blood was used and the donation procedure. They talked about their blood types and whether these were best for whole blood or plasma, their knowledge of deferrals, and about preparing for a donation. Overall, participants talked in this theme about learning about donation through donating over a period of time. And having this knowledge and being able to demonstrate expertise in blood donation may be particularly important for older people, particularly after retirement, when loss of expertise gained through work roles can be significant. Participants also talked about blood donation as a way to contribute to the community that they didn't perceive to be costly. They talked about donating blood as not requiring monetary resources, which has also been reported in literature on student samples. Blood donation being easy to organise, requiring less of a time commitment compared with other volunteer activities. And I mean, even though, people often think of older people as having more time, and some of our participants did talk about having more time, they actually also discussed being quite busy. However, potentially not just with work, although 42% of our participants were working or studying and were busy with work. Even those who were retired talked about having to fit donation into their schedules. Because they'd taken up a lot of other activities in retirement, such as looking after grandchildren. So for these participants, donation was perceived to be a more time-efficient way to contribute to the community than other forms of volunteering. Participants also indicated that they found donating blood to be a physically easy activity. They talked about not experiencing complications while donating, being able to donate quickly, and their overall positive donation experiences. In particular, a number of the male participants noted that they were able to donate blood really quickly. Participants also talked about being eligible and able to donate. And in this theme, what they talked about was actually being grateful that they were able to help others, and they differentiated themselves from blood product recipients who they perceived to be much more unwell than them, and they obviously considered themselves to be, fortunate at their age that they were able to donate and didn't need to receive blood products. And a small number talked about donating blood as being beneficial for maintaining their health through the receipt of regular blood pressure and hemoglobin readings as part of the pre-donation screening. So when we asked participants what they thought about the age limit being lifted, unsurprisingly, they were all very positive about these changes, particularly for themselves. And I guess the main reason that they considered this to be a positive was that they didn't think that age made any difference to a person's ability to donate blood. And obviously we know from the literature that there's research evidence that blood donation is safe for older people. But from these participants' perspectives, what they saw was that, well, at their age, yes, some people were healthier than others and some people were less healthy than others, and that blood donation agencies have deferral criteria that are sufficient to defer those people with health concerns without needing age as an additional deferral criteria. So the participants very clearly differentiated between health and old age and believed that there was no reason to assume that older people would not be healthy enough to donate just purely because of their age. And the majority of participants said that they would like to donate for as long as they were eligible, and indicated that they assumed that they would eventually be deferred due to health reasons. And also on the topic of the changed eligibility criteria, the participants also felt that this made sense in terms of blood collection agencies actually being able to recruit sufficient donors, because they felt that current donors who are older are obviously people who are familiar with the procedure and tolerate donation well. They felt that at their ages, people had more time and motivation to donate. And they also talked about the social roles and identities that had been, that they felt had been developed and maintained through donating blood, and the potential impact of the loss of these roles and identities for some older people if they were no longer able to donate. Some of the participants suggested that telling committed older donors that they were no longer eligible because of their age could further contribute to social isolation or take away an opportunity for these people to make a positive contribution to the community. And this perspective highlights participants' concerns with the potential social consequences of permanently deferring older people from donation based solely on age. Conversely, as some of these quotes indicate, removing age-based eligibility criteria would signal that people are still valued as donors regardless of their age. So just to summarise the findings from this study, we found that life experiences and donation experiences together tend to shape meanings of donation in later life. Our data suggest a class or a generational aspect to this motivation, as participants who talked about giving back mentioned having financial resources to be able to retire or semi-retire. And this fits with our data that Australian blood donors are more highly educated and more likely to be in paid employment than non-donors. And this research suggests that for some older people, being a blood donor is an important social role associated with a sense of self as healthy, knowledgeable, and able to make a valuable contribution to the community. And opportunities exist for blood collection agencies to boost supplies through keeping older donors in donor panels for longer and recruiting more donors in later life. Some ways that we could do this is to actually feature people in middle age and older age in campaigns, so that people can see themselves and their experience in campaigns, and addressing misperceptions about the eligibility of older adults to donate blood. We could also tailor messaging to the motivations proposed by participants in this study, such as providing opportunities to contribute to their communities through blood donation. And now I'd like to present some findings from another study that we conducted last year, looking at donors aged 70 and over in Australia and how they responded to messaging not to donate blood during the early months of the COVID-19 pandemic. So we distributed surveys to 2 groups of active donors over the age of 70 in September 2020. They were sent via email. We sent the survey to 2 different groups of donors, people who had donated during the pandemic period, which we classified as being from March to September 2020. And donors who hadn't donated during this period. Both surveys included questions about donors' perceptions and understanding of advice to stay home during the pandemic, as well as questions about appointments, any questions that people had about donating during the pandemic, and intentions to donate in the future. We conducted mostly non-parametric analyses, and our participants who completed the surveys were generally representative of our broader 70+ donor panel. So approximately 60% were male, 40% were female, and a slightly higher proportion of men completed the, compared to the 70+ donor panel, the proportion of males was slightly smaller. The mean age of participants was 73. So just a little bit of background. During the early pandemic period, people in their 70s and over would have received different public health communications. So the Australian government at the end of March asked people over 70 to stay home as much as possible because of evidence that suggested that their likelihood of becoming seriously ill from COVID-19 illness was quite high. However, at the same time, the blood collection agency, Lifeblood, was emphasising the need for blood donors and actively asking blood donors to come out and donate during the pandemic. And then later in March, Lifeblood also advised the over 70 donors to avoid donation at this time, both by cancelling existing appointments and not making new ones. So there were 3 sort of different levels of communications that people may have received during this time. So what did we find? We found that over 95% of our participants were aware of government advice to people in their age group to stay home as much as possible to avoid becoming infected with COVID-19. However, we found that less than half of the participants thought that the government advice to stay home included not donating. And overall, 66% of participants had received information from Lifeblood about donating during the pandemic, which included emails or SMSs asking donors over 70 not to donate, to cancel existing appointments, and to not make new appointments. So of the 66 who recalled receiving advice to cancel and not make further appointments, we asked what they thought about this advice. 57% agreed with the advice, 30% disagreed, and 12% were ambivalent. And there were significant differences between donors and non-donors. So 50% of donors agreed and 37% disagreed, compared with 69% of the people who hadn't donated during the pandemic who did agree with the advice, and only 20% disagreeing. We also asked people's perspectives on whether they would follow future advice to cancel appointments and to not donate. And of the people who had already made a donation during the pandemic period, 54% intended to follow future government advice, 24% didn't intend to follow it, and 21% were unsure if they would follow this advice. The most common reasons for intending to follow advice were trusting the advice of public health experts and believing that this advice applied to them. So of the quarter of the 70+ donors who indicated that they wouldn't follow future advice, 34% indicated that they didn't believe donating during the pandemic was risky for them. And a similar proportion believed that they were healthier than most people in their age group and therefore were able to donate. So we can see here, this pie chart shows the different reasons that people gave for not intending to follow advice to not donate blood. So the most common ones are, I'm healthier than most people in my age group and able to donate. I don't believe donating blood during the pandemic is risky for me. So we also asked people how confident they were that they would donate again after the pandemic. Um, Participants' confidence that they would donate, during and after the pandemic, it varied greatly. So people who had already made a donation during the pandemic were much more confident that they would make another donation during the pandemic, so 84.5% compared with 50% of non-donors. And after the pandemic, almost all of the pandemic donors, so 95%, were confident that they would donate again after the pandemic, compared with 82% of people who hadn't donated during the pandemic. So just to discuss these findings from this survey, Australian donors aged 70 plus were unsure of whether they should be donating blood during the study period due to the different communications that they were received. While most of those who received advice not to donate did intend to follow it, a reasonable proportion didn't intend to follow this advice. The most common reasons for intending to follow advice were based around trusting public health experts or believing that the advice applied to them. The most common reasons for not intending to follow advice centered around the belief that they were healthier than their peers and that donating would not be risky for them. And these reasons are likely to be due to the perception that as someone who's eligible to donate, they're healthier and unlikely to become as seriously ill from SARS-CoV-2 infection compared with others in their age group. So from these findings, it does look as though asking donors not to donate doesn't seem to have a negative impact on intentions to donate after the pandemic, with most of our participants indicating that they would come back to donate. However, we haven't done these analyses yet, so we don't know whether donors did actually return to donate. Those who had already donated during the pandemic had high intentions to come back and donate again during the pandemic, suggesting that despite messaging advising them not to donate, that these donors did actually feel safe in donor centres during those times. And so overall, considering these findings alongside the qualitative findings, together they indicate that being a blood donor in older age can be associated with a self-identity or a sense of self as someone who's healthy and aging well compared to other people in their age group. And having this positive sense of self in older age may be a positive, as in it may counter loss of identity that can be associated with older age or associations between age and frailty. As we discussed in the findings, older adults talked a lot about the knowledge that they had of blood donation. This may be a real positive for older people who have retired from work to have this knowledge and expertise in addition to actually being eligible to donate blood. So in this way, donating blood may help older adults to maintain a positive sense of self as someone who's able to make a contribution to society and who's not frail. Encouraging healthy older adults to consider blood donation could be positive for older people and blood supplies. And then, what about what happens when we ask our older donors not to donate? So, for example, during the pandemic or when permanently deferring donors. I think our findings suggest that this needs to be explained to people in a way that will not be perceived as being ageist. So explaining this in terms of prioritising health seems to work for some donors, but not all. As we saw, a reasonable proportion of our donors considered themselves to be healthier than the general population of their age group. For these people, a more detailed explanation of the reasoning may need to be offered, or potentially the organisation may need to offer older adults other ways to positively reinforce their identity by offering them other ways to contribute, such as recruiting other donors or volunteering for the organisation. overall, older adults seem to be very positively oriented towards donating blood and want to continue to donate and can make significant contributions to blood supplies and should be encouraged to do so. Thank you very much. I'd just like to acknowledge the other members of our team here in the donor research team at Lifeblood who worked on these projects with me. So Lily, Kyle, Nikki, Tanya and Barbara. Thank you very much. Please get in touch if you have any questions.